Today on Hatching for Health. Today's guests are very special to me as well. We have Dr. Anthony Johnson, who is an internationally renowned specialist in maternal fetal medicine, and we have Dr. Mary Austin, who's a pediatric surgeon.
I was 21 weeks when I went in just for a routine anatomy ultrasound, and they said, oh, hey, her stomach doesn't look like it's in the right spot. So we went to the specialist, and they're like, she's like severe, there's not much we can do.
Hi, I'm your host, Jessica Hatch. We are here today to inspire hope, spotlight rare battles, and unite families. And today's show is actually sponsored by the Fetal Center at Memorial Hermann Hospital and McGovern Medical School, UT Health Houston. Today's guests are very special to me as well. We have Dr. Anthony Johnson, who is an internationally renowned specialist in maternal fetal medicine, and we have Dr. Mary Austin, who's a pediatric surgeon who actually performed surgery, in addition to Dr. Johnson, on today's guest daughter. So thank you all. Welcome to the show. And Courtney.
Hi.
Hi, and your daughter will be joining us in the second half, Araya. So thank you guys all for being here and being able to kind of tell the story about your little one.
Yes.
Yeah, so I just want to start by kind of understanding, where things were at in that moment that you realized, this was during pregnancy, so this is not where the baby's been born yet.
I was 21 weeks when I went in just for a routine anatomy ultrasound, and they said, oh, hey, her stomach doesn't look like it's in the right spot. So we went to the specialist in San Antonio. I lived in San Antonio at the time. Went to the specialist there, and they're like, she's like severe, there's not much we can do. I'm like, okay, I need more options. Mm-hmm. So I called another hospital. There's not much we can do. So I was Googling treatment options, and I ran across the Fetal, and I made the call, and we were in office next week.
Wow. And so this condition that your daughter ended up getting diagnosed with is known as Congenital Diaphragmatic Hernia. It just sounds serious. So tell me a little bit about when you did find somebody that was able to see you, and this was actually
the Fetal Center, Dr. Johnson. We found out that her stomach had herniated through her diaphragm. Her liver had partially herniated. Her intestines and her heart had shifted all the way over into her right armpit.
Wow, and this is at 21 weeks?
This is at 21 weeks.
Okay. So Dr. Johnson, is this condition typically not found until an anatomy scan, or is it something that, y'all are made aware of sooner than that?
About 2/3 or more are picked up in second trimester ultrasound, and if we pick it up, it's the more severe cases. Some are missed, and they don't see Mary and Dr. Austin until later on when the baby's having respiratory problems. They're small, they're not as severe in the context. The ones that we see prenatally, it's a mass effect. The more you have up, the more likely you are to pick it, the more severe it is. And that's what happened here.
Yeah, so the longer it takes to be, recognized is obviously the more severity of the case. So in this moment, was something that you guys traveled here to Houston to get that initial consultation?
Yes, and initially I just wanted somebody to tell me that my baby was worth it enough to try to save her. And that was the Fetal Center was the first place that was like, oh, like, we can't promise that she's gonna make it, but we can promise we'll try.
I mean, this is a surgery, we're talking in the utero. Like, this is not, baby's been born. I mean, the fact that these surgeries even take place, mesmerizes me, which is why I so badly wanted to have, some of their group slowly come and tell some of these really miracle stories. I mean, even people I was talking about today's episode, and I'm like, yeah, the surgery took place on the fetus, and they're like, what? That's not possible. I'm like, yeah, it is. I'm like, and then just understanding there's so many different conditions that even may or may not be operable, but just kind of researching this, I mean, you and your husband, I mean, what were you going through in that moment?
It was terrifying. Like, it was a double-edged sword, really, finding out that we even qualified. Because it's like, in order to get fetal, you had to be like on the extremely severe side. And it was like, I don't even know how to put it. It's like, yes, we have a treatment option, but in order to get this treatment option, she doesn't have much hope.
Oh,
So it
goodness.
was extremely hard.
And, Mary, Dr. Austin, I mean, this was just so difficult, these families coming in. I mean, and you guys obviously want to be the most optimistic, but the reality is that, not everybody is a survivor.
Right.
And I think even like 1 in 2,500 are diagnosed with this. This is like, those
rare.
are astonishing numbers. I mean, I don't know how many of them actually get to find you guys, but I mean, just tell me a little bit about when the patients, actually get to you, like, what you're doing to comfort them and this possibility of a cure.
Well, you're absolutely right. I mean, it's real balance between being honest and transparent about what we can offer and providing that hope, but also, having a realistic conversation and having realistic expectations for their baby after their baby's born.
Dr. Johnson, so congenital diaphragmatic hernia, like just for layman's terms, like kind of explain that to an individual that might be getting this diagnosis.
It's an embryologic defect where when basically the fetus starts to develop, its bowel contents are out, and then as it closes the abdominal wall, the content sort of rests normally in the abdomen. Well, the diaphragm acts as a shelf, so everything comes in, stops there. If you have a hole in the diaphragm, point of least resistance, I'm just going to keep migrating. And depending on how big it is, depends on how much it is. So in Courtney's situation, it was a large defect. So it's not just bowel and stomach, but it's also liver, which is up in the chest. The lungs are nothing more than balloons. They can't push out. So if you push on them, they'll collapse. In the context of stuff. Now, I mean, it's simplistic, that's the situation, but embryologically, there's other things going on. In this situation, you're looking at a scenario where that type of a defect, the severity says survival without doing anything is probably on the order of 15 to 40% at best. That's just survival,
If nothing's done.
Right, that's just, do you get to the NICU, all right? So the intervention that Dr. Austin and I are working on, we call it fetal endoluminal tracheal occlusion. We're going to put a balloon in the baby's trachea while it's roughly three months away from its due date. So in that scenario, what that does is that occludes the trachea. So the lungs, which produce fluid, the balloons blow up. So now you increase the volume of the balloon. This only works though if you have a continuum, what we just pointed out. I can do a lot of things as a fetal guy, but if I don't have a postnatal team to pick up the ball and run with it, you don't run the relay race. So it's a continuum, and it's after Dr. Austin gets done with taking care of the baby in the nursery, then you've got the diaphragm hernia clinic. It's a long-term project. Courtney can tell you how many times she's been dealing with the CDH clinic. Now we got a lovely little girl here now, and she's a superstar. She's a winner. She's a poster child for what we're looking for in this regard. But she was very, very sick as a fetus.
Oh, I can imagine. So, and basically she now is, thriving. Like she horseback rides, she plays soccer, or basketball.
She's a cheerleader. She just won her first national title for a beauty pageant.
Oh, wow.
Like
so
she's
doing it all.
She does everything.
So do you have other children?
I do. I have my son will be 12 next week.
Okay. So you had a boy that was a few years old during this time.
He had just turned 5.
Okay. So, you're basically being told like, you, mom, are about to have surgery along with your child. Like, is this something that you did under anesthesia, or was she okay?
Actually, we try to minimize. It's maternal fetal surgery. Mom didn't do anything.
No,
she's a care of the process.
Right.
So part of the situation is, as I said, we can do a lot of things, but we've got to minimize risk to mother. So in this setting, really, a lot of this is done just with simple sedation and local. We put a device in, for lack of a better description, it's a straw. And through the straw, Dr. Austin and I are going to direct this telescope into the baby's mouth, the fetus's mouth. Once we get into the mouth, we're going to direct it into the trachea. Then Dr. Austin is going to deliver a balloon, which we're going to inflate. Now, once that balloon's inflated, it's a time bomb, because what's going on there, it's static. So for the next 7 weeks, we have a team of people that are on for 24/7 in the event Courtney decides to come into labor, which is, we can't control the obstetrical
Which
parts.
happened a few times.
Yeah, you and I saw each other a lot of times at 3 in the morning.
Because that has to be removed before
right,
labor.
if the baby's born with the balloon in, the baby will die.
They will die.
So we have a team that's in play, constantly for 7 weeks till we get the balloon out. Then the balloon comes out. okay? You want the baby to recover some, and then hopefully we get a couple, 3 or 4 more weeks out of it, and the baby's obstetrically, we just go from there, and then it's delivered, and Dr. Austin and her team on the NICU side will take care of the repair and the management of the diaphragm like we would any other diaphragm. But we've now improved the outcome. So we've taken 15 to 40%, and now we're looking at 70+% of survival.
Wow, okay. That's huge, numbers. So at that point with the surgery that you have to do, is that something that, I'm assuming like kind of like an open chest surgery when they're born?
So there's a couple of different approaches that we can use, but for cases like Courtney's surgery, we usually use an open approach. And that means that there's a cut in the belly, and that allows us access to the chest and the diaphragm, and we carefully bring all the stuff that's up in the chest back down to where it should be.
Okay.
And then we close the diaphragm, and we, in a severe case, we typically have to use a piece of synthetic mesh called Gore-Tex to close that hole. I tell folks it's kind of like repairing a hole in your pants. If it's a small hole, you can just sew it up. But in the case of more severe diaphragms,
your pants, a very different comparison. But
you need a
yeah,
patch.
to make people understand what you're saying.
So, and I think that's something we talked about before she was born.
You gave her a little bit extra so she could grow into it.
So she could grow. So you make a little pop tent, so there's extra room kind of for her to develop.
And how long does this procedure take, or the initial one that's actually done on the fetus?
If you're lucky, you're done in 15 to 20 minutes. If you're Courtney, you take 2 hours.
Really?
Because you got, there used to be an old expression about mark twice, cut once. You want if the fetus is in the right position, you go straight to work. Part of what we have to do is once we decide what we're going to do, we're going to paralyze the baby. So there's an injection into the baby to give it an anesthetic and to paralyze it so it doesn't move, all right? So it's something you have to warn the mother of. Your baby, you're not going to feel it move for the next 6 hours.
So in this moment, you're telling her that we're going to give a shot to your baby that's going to paralyze them.
So the baby stays in the position where we need to be because we don't need the baby fighting us. And then we come
I would be panicking too.
And then after that, we go and we deliver the balloon, okay? And then after we're done with that, she's going to go to a recovery area for a couple of hours. We'll watch her overnight. And then she moves into Houston because, again, the balloon's in place. So the mother has to be within 30 minutes of the hospital for the next 7 weeks. And 30 minutes, as you know, in Houston is not 30 miles. That's blocks, okay? So, and she has to have someone with her so that, again, if a mother gets into, because remember, it's a pregnancy, so they can have preterm labor. There's obstetrical issues that cause problem about 20% of people.
Okay. Is there anything after that's done that she could do that would, essentially pop or deflate that, and cause an adverse reaction? Or is there really, she goes about her normal life?
There have only been a few cases where the balloon's been coughed up, if you will. Once it's in place, it does stay in place, okay? So then it's just imperative to be able to get it out in a controlled, timely manner.
Okay. Right, I didn't want to let hers go.
Yeah. And your husband, how is he handling all of this?
Then he was kind of numb. He was trying really, really hard to stay strong for me, and I was such a mess.
Yeah.
And now it's Araya is his best friend. 110% daddy's girl.
How sweet.
And he's always there, and he's doing really well with it.
I love hearing that. It's obviously wonderful when you have the other parent that's, part of it and can be the rock,
Well, and during the initial consultations, we were told an issue like this and a birth defect like this could absolutely make or break a marriage. We had only been married for 4 years at that point. We'll be celebrating our 11-year anniversary in July.
Amazing. So thanks to you guys for the marriage. Stay together now. We do have to take a quick commercial break on a lighthearted moment. Stick around. We still have an amazing show for you. And we are going to meet the little girl that was cured of this CDH condition after the break.
The night before, I had sat outside the hotel room and I prayed and prayed and prayed. And I was just like, God, if she's meant to be mine, make her strong. If she's not, then I need you to make me strong.
Yeah.
And
that's amazing. That's really all you can do, right? Hey, welcome to Infinity Diagnostic Center and Prestige Medical Pain Clinic. We are right here in the heart of Houston, inside the 610 loop. We do interventional pain management and we do MRIs. Our MRI facility offers a 1.5 Tesla Siemens magnet. We can do MRIs of the brain, spine, any extremity, foot and ankle, we got you covered. Then we have our pain suite. So our pain suite is for when you do have that pain. You get the MRI and now the doctor can sit and evaluate that MRI with you and look at exactly what's going on. And right here, they'll do an interventional pain injection, ESIs, transforaminal, a various amount. We've got 2 doctors on staff, so we got you covered. Before you actually get set up over here, you're gonna come to our consultation room in which you will be visited with one of the specialists. And we're treating insurance, cash patients, Department of Labor, and personal injury, which is so important. So we can take care of all of those different needs. Just come see us here at Infinity Diagnostics and Prestige Medical Pain Clinic. Welcome back from the break. We are finally going to get to meet Miss Araya, also known by JoJo, and she is the one that had this surgery while she was a fetus as well as after she was born as a little baby newborn. So it is so special to have you here. How are you?
Good.
Do you like for you to go by JoJo? Is that the name you like to go by? And you do pageants? Because you look all dressed up like you're going to go perform on a stage. Yeah, I love the outfit. And Courtney, when you first, met with Dr. Johnson and their team, I guess what kind of confidence did you have? I mean, being, assuming a non-medical professional and learning these things, like in the whole process.
I was kind of just, when we got invited for Fetal, I had said, the night before, I had sat outside the hotel room and I prayed and prayed and prayed. And I was just like, God, if she's meant to be mine, make her strong. If she's not, then I need you to make me strong.
Yeah.
And
yeah, that's amazing. That's really all you can do, right? Is pray and trust, what they're about to do.
And I had asked Dr. Johnson, I said, well, how many of these have you done? He said,
So you're the first.
Back
0 now.
The time, yeah. I mean, part of bringing the procedure to Memorial Hermann was a situation we trained in Europe, and then after training in Europe, we had to participate in 15 different procedures at surrounding sites internationally. So a lot of travel was done from 11 to 16 to get it tucked in, and then part of the process was putting the entire team together. So it's been. Before we met Courtney, we had been busy with it for 6 years, with everything from animal work to model work to get it done.
Really? So
yes.
she was actually the very first
case that we did at Children's Memorial Hermann Hospital. Yep.
Isn't that incredible?
Yep.
Well, if those are the outcomes you start with, wow, I want to go there. That's
You
quite
set our
amazing.
expectations high.
Very high.
Yeah,
Very high.
I know some of the things. I mean, you guys are like leaders in CDH research, which I had kind of talked on earlier, and I read that you guys have published more medical journal articles on CDH and teaching at local, schools and across the country, really. Are you guys just, big advocates in general from the fetal center perspective, or is this condition really highlighted with y'all?
I joined the group in 2011, and part of my reason for coming was my interest in diaphragm hernia and what had been started earlier with Dr. Kevin Lively and the work there under his leadership in the pediatric surgery division. And then I was fortunate to have a chairman that also was supportive of establishing the fetal center. Mary and I met each other there, with Kojin Sao, and Kim Owies was then my associate, and we took from there 2011, moved forward with this endeavor. But diaphragm hernia is a very big interest in what we do there. But we're also a full service fetal center. So fetal malformations of any sort, if it's treatable, we're probably taking care of it. And if it's not treatable, we'll probably try and figure out how to treat it. I mean, that's what we do.
Of course. And just, to briefly, like, what are some of the other, more common conditions that I think y'all treat spina bifida?
Spina bifida. Mary's part of the major team as far as she's doing fetoscopic repair spina bifida. We're actually the only program in the country right now that's using a unique process where we use an umbilical cord patch, which seems to be improving the baby's healing process. In that scenario, those babies where some centers are seeing a certain maybe 20-25% are walking. We've got babies that are walking at 14 months in over 60% of the cases. So it's really revolutionary. Yeah. great deal of work there.
Yeah, because I mean, you guys are essentially like a national referral source. I mean, you're probably on many facilities around the country's list of like, this is going on, the fetal center, you know? And that's what it sounds like anyway.
We don't say no.
Yeah.
I mean, we're here for a purpose, okay? And we do make it a point to be available. We have the opportunity to work with a team of people from the entryway with the receptionist all the way through. It's about the patient. It's about Courtney when she gets there, about how do we put it together, bring everybody together. As I said, it doesn't work in a fetal program if you don't have a pediatric postnatal team that can run with the ball, and that's what we have.
And so obviously like at birth and her immediately having this surgery, like it doesn't stop there. I mean, you know, we talked a little bit about from that point, like what does that journey look like to really gain confidence in her, you know, survival rate?
We've been hospitalized quite a few times. A couple really, really scary times.
Was this like within the first few years or?
We have been hospitalized more recently, now that she's getting older and she hit a growth spurt.
Okay.
And her asthma is becoming more pronounced.
I see.
Than we have in the past. In the past, it was like bowel obstructions were more of a concern than her lungs.
Okay.
Now it's her lungs are more of a concern than anything else.
Okay. So do a lot of these organs, you know, I don't want to say suffer, but tend to have different issues versus it just being about the lungs because of during the time it was like kind of squishing everything?
Right. So there are a couple different challenges that children with CDH can face, and certainly the lungs are a significant one. It's not uncommon for the children to have asthma, and it's not uncommon for, if they get a respiratory infection, for it to be much more severe than it would be in a child without CDH.
Okay.
And then in terms of the surgery we do on the belly, when we bring all those abdominal contents back into the abdomen, that produces some scarring. And what Courtney's referring to as a bowel obstruction, that's usually due to scarring after this initial surgery. And that can happen in the first year, but it can happen much later as well. So there are some challenges that babies with CDH face, not outside of just the respiratory ones.
Of course. And so do you guys have regular, you know, appointments that you still have to come into Houston for?
We go to the CDH clinic.
Okay.
That's not what it's called, but that's what we call it. We go to the CDH clinic once a year.
Okay.
And we've graduated. We used to go every 3 months.
Great.
Now we're down to once a year.
Awesome.
And hopefully we graduate to like every 2 years here soon. I'm hoping.
Okay, good. Yeah.
Not that I don't like seeing you.
I know.
But
And what kind of pageants are you doing, JoJo? Little beauty pageants? Really? Do they ask you a question on stage? They do?
yes, ma'am.
Yes, ma'am.
Wow. Well, is there, you know, any advice that you could give like other parents that have just gotten this news about their little one?
Not really. Because it's terrifying. Like there's nothing that is going to take that fear away. And there's nothing no one can say or do to take that fear away. It's always going to be there. Even today, like I'm absolutely terrified that she's going to have an asthma attack at school and I'm not going to get there in time. But I let her be a kid, and I don't let fear keep her from being a kid. She's jet skiing. She wants to go parachuting for her birthday.
She's not scared of anything. So, I mean, obviously, it sounds like you're, you know, Christian. Also, I guess having the faith in this group of doctors that, you know, gives you as much like confidence as you can possibly gain.
All I wanted was somebody to try.
Yeah, and they were.
Yes,
for the first time, and look at her.
They tried.
Such a beautiful blessing. Just at this point, I mean, this is several years later. You guys are up in the numbers on this particular. Are you getting a lot of these referrals now?
You know, you mentioned 1 in 2,500. Okay, that's when we're looking at diaphragm hernia overall. This one's exceedingly rare. It's about 1 in 10,000. Okay, so
Okay.
it's a rare case, and again, of that 1 in 10,000, you're going to probably make it more like 1 in 16,000, because remember, the 40%, there's something else going on that they wouldn't be a candidate for this.
Okay.
So it's exceedingly rare. Yes, we still see we've got 1, 2, 3 in the kitty right now, and another one coming in next week. So we're busy. Yeah.
You guys' analogies. It's like, what, also like just from, the both of your perspectives, like just some advice you can give, to a parent or parents, kind of learning this news or any other serious news that.
What Courtney said a second ago is not an uncommon thing that we hear, that someone sees it outside and says, that's really terrible. And I've had patients come to me and say that I was told I should prepare for my baby's death. And because of what we do, we are a national referral center. So things that someone might only occasionally see once in their career, we'll see 3 times, 4 times a year. So that what might be the worst thing they ever saw, yeah, it's bad, but it's manageable, it's treatable.
Yeah.
And let's talk to you about it, and let's see what's going on. Let's give you concrete information so you and your husband can make a decision about what it is that you as a family want to do. That's what we do at the Fetal Center. We don't point them in a direction. We give them information, then help them make the path.
And I think you guys do a great job of that. I've have, a bit of a personal relationship with the Fetal Center and Dr. Patty, and firsthand, I know that the conversations that you guys had are very difficult, but there's just something about, the deliverance and the, confidence or just, direction that you makes you feel comfortable. So I can speak on that as well.
And that reminds me, one of our first visits together, Dr. Johnson said, and I wrote it down on my notebook that I have in her NICU box. He said, numbers don't mean anything. It's either 100% or 0%. If it happens to you, it's 100%. If it doesn't, it's 0.
There you go.
And that's what we've gone by.
Yeah, that's beautiful. And Mary, is there anything else you want to add just on an advice perspective?
I would just echo what Dr. Johnson and Courtney are saying, is that the shock and fear that one has when you're told that your unborn child has a major problem, that's just unmeasurable. But do your homework, ask questions, and seek out a center of excellence to get the best information so you can make the right decision for you and your family and your unborn child.
And is the fetalcenter.org, or is it Memorial? I know you can kind of find you guys through a lot of the websites, but is it the fetalcenter.org?
If you just type in the Fetal Center at the top, you're going to get us.
You're going to get you
Fetal
guys,
Center Memorial Hermann is going to get you where it is.
Okay. Wonderful. And I do have a little gift for you, JoJo. If you can bring that out. We just have a little basket. I hope you still like flamingos, but there's some other little stuff, a shirt in here.
Flamingos.
Awesome.
Yeah. That's for
What do you say?
Oh, wow.
For taking the time to come and tell your story.
Are you so excited?
Wonderful.
And a bow.
Well, thank you guys all for coming out.
Thank you for having us.
And Courtney for being vulnerable to come and share. And I appreciate the both of you for joining us.
Thank you.
And thank you all again for tuning in to this week's episode. And we want to thank our sponsor, the Fetal Center at Children's Memorial Hermann Hospital and McGovern Medical School, UT Health Houston. And we'll be right back here with you next Saturday. Good? Okay.